Okay, this video is more about health, and it does mention the song artist because I was so emotional over her situation and what happened to her. Now, I don't know her personally, but I was a fan, and still I am a fan of Aretha Franklin, her music. And her music will definitely live on, but I was more looking at the serious side of what was the cause of her death. And so I kind of did a little I'll say mini research on what it was that she was battling with. And I found two articles that I thought were um, really pretty good articles for me, to understand what this woman went through, in her life, and also what cancer, a type of cancer she was battling with, and also how it affects, how it could affect anybody else, for that matter of fact. And so Aretha Franklin, she died of a deadly cancer, and it says that gets little attention. And so this article is out of the Huffington Post. It's by a Carolina Moreno. But the doctors hope that the icon's death helps raises awareness of the risk factors and a need for research around this disease. And so I'll say this, and it probably happens in a lot of places where they have, cancer awareness, but I don't really see it as much. And I don't know if anybody, correct me if I'm wrong, I feel like there's more of an uptick with the cancers. And it's happening a lot lately. I noticed that. And so this is a beautiful picture of Aretha Franklin pictured here in her earlier days. And so it's more of like a tribute that they had for her here. And I thought this was a really beautiful picture of her. And so Aretha Franklin, the beloved Queen of Soul, died Thursday at age 76 from advanced pancreatic cancer of the neuroendocrine type. So as the singer is mourned worldwide, her tragic death is also helping shed some light on the disease, experts say, is particularly deadly and in need of funding, research, and overall awareness. So pancreatic cancer is difficult to detect early and spreads quickly in the body. The majority of the patients, 94%, will develop adenocarcinoma. It's adenocarcinoma type, which has an overall 5-year survival rate of 8%. So by comparison, the survival rate is 90% for breast cancer, 65% for colon cancer, and 18% for lung cancer. So Franklin had a less common type of pancreatic cancer, which is characterized by tumors that form in the pancreas, a hormone-making cell. So while this form of the disease has a slightly better prognosis and spreads less quickly than an adenocarcinoma, researchers say both kinds are in dire need of awareness. Pancreatic cancer is projected to become the second leading cause of cancer death in the United States by 2020. Dr. Diane Simone, a professor of surgery and director of the Pancreatic Cancer Center in New York University, NYU. So it's Langone Health told the Huffington Post this. So what has been traditionally thought of as an uncommon cancer is actually increasing in frequency. So this is what I was saying, that I've been seeing or hearing a lot of people saying that they've developed even small types of issues but it's cancerous, or they have to go get tested on skin cancer. There's different types of cancers. So, and it's been happening a lot more lately. And so in the United States, an estimated 55,440 new cases of pancreatic cancer will be diagnosed, and about 44,330 people will die from the disease this year, according to the American Cancer Society. And so for experts, the distressing single figure survival rate means it's one of the deadliest major cancers, and more must be done to help those at risk. So, pancreatic cancer is projected to become the second leading cause of cancer death in the United States by 2020. And this is by Dr. Diane Simone, director of NYU at Langone Health's Pancreatic Cancer Center. So, Dr. Christos Fontzilas, an oncologist specializing in pancreatic cancer at Roswell Park Comprehensive Cancer Center, told Huffington Post that what makes this type of cancer particularly deadly is that it spreads early, impacts vital organs of life, and is resistant to traditional types of treatment. So when you compare it to other cancers, pancreas cancer tends to be a cancer that is not sensitive to the usual chemotherapy medications, he said. And while neuroendocrine type spreads more slowly, he adds, once it grows outside of the pancreas, they can still be lethal, even though they don't move as quickly as the angiocarcinoma. So while data surrounding pancreatic cancer is far from encouraging, experts told Huffington Post there is promising research in the works around early detection and treatment. So still, there is a long road ahead, and they hope Franklin's death will help raise awareness around risk factors and the need for more research. So I don't think pancreatic cancer has gotten enough attention. I don't think it's as supported as it should be by agencies, Fontzilas said. So we are better in terms of awareness compared to 10 years ago, but there's still work to be done. So for Simone, or Simeon, so I may not be pronouncing the names correctly, so I'm sorry for that. That work includes changing people's pessimistic attitudes towards fighting the disease. So there's actually a lot of things that can be done, and it is very important that the information gets out to the public about the risk factors and new treatments, she said, adding that those diagnosed with pancreatic cancer should always consult with an expert and, if possible, participate in clinical trials, because that's the only way we're going to move the needle in the future and not have unfortunate deaths of pancreatic cancer like we're witnessing this week with Aretha Franklin's passing. So know your risk. And so while there have been advances in early detection for other major cancers, currently there are no effective tests that can be routinely performed to detect pancreatic cancer. So this is particularly troubling because early stages of this disease usually show no symptoms. And so I was listening to what I was reading and then reading some other literature on this disease. And when I saw this where it said early stages, and that's the key factor here. A lot of times people will go get tested or they have early signs or symptoms of something. Well, this right here says early stages of the disease. It has no symptoms. So these were runners. They approached the finish line at a Pancreatic Cancer Action Network Purple Stride. It's called Purple Stride 5K Run Walk. And this was June 16, 2012 back then. So, they always have these little run, like little run-a-thons or to try to bring awareness to these diseases. And so there are imaging tests that can be done of the pancreas, but they're not quite as sensitive or specific as we need. So Simeon said, there's a lot of work to be done in trying to develop the early detection in blood tests, and some of the work is quite promising, but it's still several years away from being validated and approved by the FDA for routine use. And so doctors know the disease is slightly more common among men and Black Americans, and individuals diagnosed are often in their 60s and 70s. But a lack of accurate screening methods means it's crucial that people know certain risk factors associated with pancreatic cancer. For example, there is a well-studied correlation between pancreatic cancer and smoking and smokeless tobacco use. So it goes on to say, but there are other risks doctors say should be kept in mind. The pancreas, an organ hidden in the upper back part of the abdomen, creates insulin and digestive enzymes and is critical in controlling blood sugar levels. Thus, both diabetes and obesity are also thought to be linked to this disease. So, in the life of Aretha Franklin, she had issues with weight. And so there were moments where she would lose weight and she would gain weight, and there were other things that were going on in her life. And so I'll eventually get to that. So the increase in pancreatic cancer that's been happening over the last decade is actually most tightly related to the increase in incidence of obesity and diabetes in our country, Simeon said. But Franz Zilas adds, it is unclear whether people develop cancer because they have diabetes or diabetes is a very early sign of development of pancreatic cancer. So genetics also play a role, according to Simeon. Somewhere between 10 and 20 or 12%, 10 and 12% of the pancreatic cancer patients actually have a heritable form of the disease. Now that means if somebody in your family had this disease, there could be a 10 and 12% of people who possibly may have inherited it. And so it's a greater risk for people who have like a family member. That's why when you go to your physician, they have you to fill out forms and they want to know your health history, your family's health history, if you know anybody that has had cancer. And usually, when people go, they'll, some people don't know who's had cancer. Some people do. They know if an uncle or a brother, cousin or father or mother. And so even heart health, the same thing. So if there's been like a pattern where people have had those type of illnesses, there could be a greater chance, or you could be at greater risk for having similar diseases like this because it's inherited. So the hereditary impact of the disease can be seen in Jimmy Carter's family, the former president who lost his father, two sisters, a brother to pancreatic cancer, and has joined efforts to raise awareness around the disease. So we recommend genetic testing, and if people have two or more family members that have had pancreatic cancer, she said, or if there is a known germline mutation in a single family member with pancreatic cancer, know the signs. So the signs of pancreatic cancer often don't manifest until the cancer is in more advanced stages. That rung a bell to me. And so I was thinking a lot, usually you think that you can see some kind of sign, but this particular cancer, it doesn't actually show up. Like it says, it doesn't manifest until the cancer is in an advanced stage. And by that time, when you're in like an advanced stage, then there's probably less likely that you can, overcome or beat that type of a cancer. And so symptoms of the disease include unexplained new diabetes, unexplained weight loss, upper abdominal pain radiating to the back, yellowing of the skin and eyes, which is jaundice. Unfortunately, many patients have vague symptoms. And so some people will have symptoms that are like this and they'll think, oh, maybe I'm just losing weight. It's no big deal. Or, oh, maybe I didn't get enough sleep. That's why, maybe I put something on my skin. That's why it's changing color or whatever. Some people don't really pay attention to these signs of these things. And they're so mild that it's easy to not really take them serious because, if you're not in pain right away, then you don't feel like it's that big a deal. And some people can have pain and they think, oh, I'll just take a Motrin or Advil or whatever and go to sleep. So unfortunately, many patients have the vague symptoms and these can go for several months. So Simeon said that adding that many people don't realize that they have symptoms and it points to the cancer as opposed to a gastritis or a reflux. So she recommends that people with symptoms seek professional expertise right away because there are treatment options available for pancreatic cancer. Fonzilla's agreed. So there are a lot of patients with pancreatic cancer that never make it to the oncologist because people believe there is no hope. And so usually when people hear that word, the big C, in any sentence that they might have it, they already have signed their death ticket mentally. They've told themselves, oh, I'm not going to make it because maybe they've heard about what cancer has done or they had a family member that died of it and wasn't able to make it. And so they don't have a lot of optimism in that kind of thing. There are a lot of patients with pancreatic cancer that never make it to the oncologist because people believe there's no hope, he said. But no matter, I think every patient who has pancreatic cancer deserves an evaluation by a medical oncologist, a surgical oncologist, because treatment options do exist. So even if not curative, at least treatments that can help people maintain their quality of life and I was thinking liver functions, live longer. There's a chance that they could live longer. Because I guess I have it in my head, they mentioned about the vital organs in people's bodies and that it affects those. And so that's why Fonzilla's and Simeon feel strongly that more must be done to improve the early detection and develop more effective therapies to the treatment of the disease. So with that in mind, Simeon will be leading a national initiative called Precision Promise at the beginning of 2019. So that seeks a rapidly test different combinations of drugs to find the better way to treat this disease, pancreatic cancer. So just like any tough medical problem we have, when resources are put to solve a problem and everybody works together, then that's when advances can be made. She said pancreatic cancer in general has been underfunded from the research perspective. And I think that needs to change. And the time for it to change is right now. And so this was by a Carolina Moreno out of the Huffington Post, and she's a reporter. And so I want to move over here to this right here. This is pancreatic cancer symptoms. And so I was looking at it. Anybody can look this up at your leisure. And so they kind of went over. They said you have pain in the abdomen, the middle back, gastrointestinal fluid in the abdomen or nausea, the whole body. You could have fatigue or a loss of appetite. Also common, dark urine, weight loss, yellowing of the skin and eyes. And so those are usually by that time. I said there's no symptoms for the early stages, and later stages are associated with symptoms, but these can be non-specific, such as the lack of appetite and weight loss. And so Aretha had plenty of weight loss, and people watch that, and that raises the red flag when you see people losing weight all of a sudden, and it's not like they're trying to lose weight, then you know something bad is happening. somewhere. So signs and symptoms of pancreatic cancer, American Cancer Society. So I'm looking, and this right here was dated the 31st of May, 2016. Signs and symptoms of the endocrine pancreatic cancer: jaundice, related symptoms. Jaundice is yellowing of the eyes and skin, belly or back pain, weight loss, poor appetite, nausea, vomiting, gallbladder. And this is why I thought of liver enlargement, blood clots, fatty tissue abnormalities, and diabetes. And so these are pretty serious things right here that are, by that time, I believe the person might be in a more advanced stage, but it's easy for people to pass it off and think, oh, I'll just take a Motrin or Abbott. Some people are not really, like it says, there are no symptoms in earlier stages. So how will you know? And so this is really something to take note of. And so this was the first article I read about Aretha Franklin died of the deadly cancer that gets little attention, which I'm trying to bring some attention to it. And so I ran across this article, and this was more about the life of Aretha Franklin, her personal struggles. So it was a quiet health battle that she had went through. So she was a teen mother, and she lost her dad, and she had her quiet health battle with the pancreatic cancer. So I didn't really want to play the video, but this one is out of the people. It was by Kate Hogan, August 16, 2018. So it goes on to say that she had 44 Grammy nominations, countless fans, and a voice many call the greatest of all time. But Aretha Franklin, who died of pancreatic cancer on Tuesday, August 16, at age 76, never had an easy road. And so the tragic loss of her beloved father, alleged abuse at the hands of a husband, and her private health battle dotted her storied career. So losing her mother, born to father C.L. Franklin and mother Barbara Siggers Franklin, the singer had two sisters and one brother, as well as a half-brother from her mother's previous relationship. So her parents separated when she was very young, though they were never divorced. And her mother moved to Buffalo, New York, and would make trips back to Detroit to visit her children. However, she died before Franklin turned age 10. And so as a teen mother, Franklin had her first child, a son named Clarence, at age 12. She was 12 years old at the time, and she welcomed a second son, Edward. So she never publicly identified the boy's father. So I still wanted to get out and hang out with my friends, she told the Ebony in 1995, of a young motherhood. So I wanted to be in two places at the same time, but my grandmother helped me a lot, and my sisters and cousins. They would babysit, and so I would go and get out occasionally. And so that was very young when she became a mother. And so this is a beautiful picture of Aretha Franklin right here. And so it goes on to say sibling rivalry. Franklin's sisters Carolyn and Irma were both talented singers too, though, as a writer David Ritz detailed in a biography, Respect, the life of Aretha Franklin, jealousy ran rampant in the Franklin family. So as sister Irma told Ritz of a proposed record deal, I would be on Epic, which was a different brand than Columbia Records, which Aretha Franklin, she signed, or they signed her on. And so they were part of a company, but I'd have my own producer and an identity separate from Aretha. And so I believe this was probably maybe one of the sisters talking. And so I thought she would be thrilled, and she wasn't. She threw a fit, and she told Daddy that she didn't want me on Epic, and that it would hurt her career, and that people would be confused by too many singing Franklin sisters. And so a similar spat happened when Carolyn was asked to record the soundtrack to 1976 Sparkle. According to Irma, Aretha ultimately got the gig for herself. So guess there was something in there about Aretha Franklin and Ted White. So this is another portion of her life, um, domestic abuse. So I've talked a lot about this, and particularly in the Black community, that this goes on and it's not talked about. It's hidden, and Black women tend to hide our problems, and we'll be private with things like this. So Franklin's marriage to Ted White in 1961 at age 19 helped her career, but according to the 1968 Time story, he had roughed her up more than once, sometimes publicly. He'd rough her up. And the two ultimately divorced in 1967. So the second divorce, the singer 1978 marriage to actor Glenn Turman, marked a more positive period in her life. And so I've never seen Aretha in better spirits. Her brother Cecil told the People magazine, but the couple divorced just 6 years later. So this divorce was more because I would suppose she was probably young, and Glenn Turman was much younger. And so it says here that I think they just grew apart was why they divorced, she told Ebony in 1995. So, and miscommunicating, we talk from time to time, and after having been together for so long, you just couldn't leave it any better than that. And so they remained friends even after the divorce. So that wasn't a tumultuous as the first marriage and divorce. So losing her father, she and my dad, pictured with Aretha and sister Carolyn, were very, very, very close. The singer's sister Irma told People in 1985. And so this is Aretha in the middle. Her father is to the left, and her sister Carolyn is to the right. And so it's a nice picture. See, this is why I was saying that Aretha was wearing natural hairstyles way before, some of the women now say, oh, I'm going to, embrace my natural beauty. And so Aretha was doing that long before. And so this is a picture of her here. So Aretha with her father, C.L. Franklin, and her sister Carolyn Franklin. I thought this was a really nice photo of the family here. And so it says that she depended on him and his advice. And when she was living in California, she called him 3 or 4 times a day. And so, stunned by the botched robbery that left her father in an irreversible coma in 1979, Franklin began traveling between California and Detroit to visit her dad. Ultimately, bought him a house in her. She bought a house in her adopted hometown. And so during her father's 5 years of unconsciousness, she spent over $500,000 on him, $1,500 a week just for a nurse, Irma said. But she still can't talk about it, not even with her own family. You can't say the word death around her, and you can't say passed away or find some other expression. And so she didn't want to talk about death, and that really took an emotional turn in her life, losing her father. And they are a really close-knit family. So remembering the Queen of Soul, Aretha Franklin's life, and the pictures. So she had a fear of flying. So severe turbulence during a small plane ride in 1982 led the singer to stop flying. So she opted to take the buses to gigs instead. So it deterred her from traveling to Cleveland for her Rock and Roll Hall of Fame induction, and even from going to England to perform for the Queen. So her son Scare, in 2010, one of Franklin's 4 sons, Eddie, was beaten at a Detroit gas station and required surgery to wire his jaw shut. So the singer never opened up about that attack though in a release statement on the Billboard, clarifying some rumors around the situation. So Eddie, her son, survived, and he eventually recovered. So this is Aretha in a later stage when she's matured, and she had started losing so much weight and she looked a lot smaller here. So this was Aretha in November of 2017, right here. And she was doing a show. So her declining health until her death, neither Franklin nor anyone in her circle would confirm, had long been rumored that she was suffering from pancreatic cancer. And this is a beautiful picture of her, even though she lost a significant amount of weight. And so in 2011 interview with the People magazine, she talked around the topic, confirming that she had not minor surgery, but leaving it at that. And so I read the rumors, and they were just ridiculous. I feel fabulous, she said. So she was very private. She didn't want to talk about her problems or her past or anything like that. And so medical issues are very personal, she continued, adding that the surgery will add 10 to 15 years to her lifespan. And so she tried to be as optimistic as possible. So weight issues also plagued the singer, who slimmed down in 2011 with the help of a personal trainer and nutritionist, not gastric bypass surgery, as was rumored. Before I ate whatever I wanted, as much as I wanted, she told People magazine. But after concerts, I'd get burgers and lie down. I went on like that until my weight got out of control. And so the new Franklin makes a mean salad, she said. I have a cup of ice cream and I go hog wild. Walking her gym's track and home treadmill helped too, as did quitting smoking for the good years earlier. And so, in a statement about her death, her family confirmed her longtime battle with the pancreatic cancer, as she has been ill for a long time, a friend told the People magazine. She did not want people to know, and she didn't make it very public. And so this was pretty telling story. So I'm going to leave it at that. And so this is pretty much my video. And so I thought the articles were really influential and to shed some light on the pancreatic cancer. And I feel like more people need to know about it, and it needs to be more awareness about not just pancreatic cancer, but all cancers as well. And so I thought this was really beneficial, and I found it to be something that was moving for me, especially to accept the fact that this woman, she was a wonderful singer, and she's seen here, pictured here, and even in her earlier days with her family, that, she went through her own personal struggles. So she's human. And so everybody has things in their life that, maybe they feel like they have to, conceal because it's a painful battle. And this woman definitely went through something. And so I wanted to know what it was she was going through. And so, two, how would it affect her being a Black woman? I'm a Black woman. How would it affect others? And by shedding light on this disease, I think more people should know about this. And by it not having the symptoms in the early stages, will and hope that they would do some more research so that they can find means to keep more of this from not happening to other people. Like it said here about the awareness of pancreatic cancer. And so I thought that was very important to bring that out, in this article. And what stood out for me is when they were stating how there were more people that might end up having this. And, anyway, with that being said, switching over here. So let's see here. Okay. Going through, I see a lot of these, benefit One Walk for cancer. They even had people wearing ribbons for cancer awareness. And usually it would be for breast cancer, but this right here is a cancer. And so I was trying to get to this where it says the US is estimated 55,440 new cases of pancreatic cancer will be diagnosed, and about 44,330 people will die of the disease this year. And so it says pancreatic cancer is projected to become the second leading cause of cancer death in the United States by 2020. And so I think that's really important for people to take notice on. And I guess this is my way of raising a little bit of hoopla over it. But anyway, with that being said, I'm going to let this video go. But I thought this was very important, very, very deadly disease. Anytime something doesn't have any real telltale signs until the very end, is something to really take serious and take notice of. But I'm going to leave this video go right here. And on this photo of her, I just really, actually, to be honest with you, I started ordering music, some more music I didn't have in my library, and I could just look at the songs and I already knew, most of the songs because I heard them when I was growing up as a child, a lot of Motown music and a lot of the, singers from Detroit, Motown era and onward. And so, I've listened, I guess I'm a, how do you say that with music? I'm versatile, but this music always gets beyond an A in my book, in terms of the soul and the flavor of the music. Is just something that, it never gets old to me. How some music, it's here today and then it's gone tomorrow, but this never gets old to me. And so she will definitely be missed. And I just hope that they do find some more research and some more ways to combat this deadly disease here. So with that being said, thank you for listening. I really, really do enjoy the well wishes and that people have given her, and then some of the things, the comments, the positive comments that people have given me, because I lost a mother in 2017. It wasn't to cancer, it was to heart disease, hypertensive heart disease, and that's also something that is really big in the Black community. I don't think people really think about, but cancer, definitely. I've been seeing a lot of people, saying that they have it, or somebody close or neighbor has died of it. And this right here really raised some flags for me. But anyway, have a great weekend, a great week, and thanks for listening.